My name is Yuliya. I am a staff psychiatrist at CAMH. I am also Ukrainian, and what I want to talk about today is the impact of war on regular Canadians in general, and more importantly, on healthcare workers in particular, because we are at the front line. We'll be probably dealing the most with the population coming in, and I think it's important for us to know how to maintain our own mental health and how to help people who are coming from such horrible experiences. And we can go to the next slide. I have nothing to disclose. There's no conflict of interest, but I say that I am Ukrainian. I came to Canada in 2007, so it was in my early 30s, meaning that I have very tight connections to Ukraine. My training was in Ukraine. I worked as a psychiatrist in Ukraine for over 7 years. I do have a lot of family members, my whole med school network, my whole high school network there, meaning that probably I am biased to some extent, but there's no any financial insensitive or any otherwise biases. We can go to the next slide, please. This is a disclosure of commercial support. I'm Ukrainian, and as I said, there's no in-kind support and there's no financial support either for this presentation. And next, please. And the information I try to pull out and present is based on evidence-based, including coping mechanisms and coping strategies we will be discussing as a group for increased resilience, and the rest is on a slide, so feel free to read it up. Yes, we're done. We can go to the next one. So what I am trying to achieve with this talk, and I would like to have it like very casual and very conversational, is to describe key challenges experienced by Ukrainian displaced people. They are referred as refugees a lot in the media, which is actually not accurate, and I will discuss the implications behind it. I would like to provide some context so it's easier to recognize what the impact of global crisis is in general on healthcare workers and patients for us as Canadians, and have some discussion about coping strategies and self-care, which I'm sure already been discussed a lot, but I think it's beneficial to discuss them in more details as related to Ukrainian war. And we can go next. So why am I presenting this topic? Why am I presenting on this population? Not only because I'm Ukrainian, but why I'm not presenting on any other populations or sub ethnical groups in Canada. So Ukrainians are very, very large group in Canada. So it's the 5th largest ethnic group, and that's by results in 2016. Probably it's somewhere the second or third at this point. It comprised 3.8% of the whole Canadian population, and Canada has the world's 3rd largest Ukrainian population, which is called diaspora, the Ukrainian older type of immigrants coming, like their ancestors coming to Canada, meaning that if you really dig in, probably almost 1 in 3 Canadians either has some sort of ties to Ukrainians or know some sort of Ukrainian in their life, or their neighbor is Ukrainian, or somebody is coming from Ukraine. We are very closely run nations, and there've been a lot of cultural ties between Canada and Ukraine, and that's probably also explained why a lot of Ukrainians see Canada as their potential country. They want to leave, or they want to escape war at this point, and this is where they see themselves being welcomed. And we can go to the next one. So what is happening right now is that Ukrainian nations can come to Canada under what is called Canada-Ukraine Authorization for Emergency Travel. This type of pathway is not a refugee pathway. So what it means that people who are coming, they're basically coming either as visitors, or they will be allowed to work, or they can go to school and they can have a student visa, or a combination of work and student. What it means on a legal level, and what it also means on healthcare delivery, healthcare services level, is that these nations coming, they do not have refugee status, meaning that they do not have the same access to social services and network security and social security in general as entitled for refugees. Depending on provinces, access to healthcare and health insurance and social insurance varies a lot. I know some provinces offer that more openly. Ontario officially expressed that they will be, or they will qualify for OHIP, for health insurance. However, what happens in reality, that actually not the case for a lot of nations coming. I brought my parents to Canada at the beginning of war. They had to cross the border, the 72 and 76. It took them 2 days to cross the border. Potentially they're supposed to qualify for OHIP. So I've been to the Service Canada 4 times at this point, and they do not. The point why I'm saying that what we see in media and what is governmental say for what people are eligible for may not necessarily be the case in reality. And we as healthcare worker, we may see people who will be coming to get services, which potentially is supposed to be available, but they will not be available given the lack of insurance. As of April, and these numbers have changed, obviously, and they will continue changing, and they will continue to increase. So the Canada received around 150,000 applications, approved around 50,000 applications as per April. A lot of applications are coming as we speak, literally, with a lot of people coming over the summertime and over the early fall, especially people who want to consider like being a student. They're coming to colleges, so they want to try universities, meaning that this number is probably going to double, maybe triple in the next year. And the distribution province-wise, basically three major provinces: Ontario, BC, and Manitoba. Most people accumulate in Ontario and BC. They're more ties associated with the community. They're also, at least in theory, there's more potential for jobs and for employment and finding employment a bit faster compared to smaller cities. So this is where the projection is, and this is where the expectation that that's going to be the biggest absorption by BC and Ontario, and probably the biggest struggle with this population as well, because eventually they will need services and they will require a lot of access to healthcare in general. There's a very specific, the population which is coming to Canada is very specific in regards to the demographic. Like if we look into refugees coming from other countries, it's pretty much heterogeneous. We have males, we have females, we have kids, we have elderly. Like it's more so homogeneous in a sense that we have a presentation from different genders, from different age groups. Because of war, because of legislation in Ukraine that men are not allowed to leave country, at least like 18 and up, the majority of people who are coming in are minors, women with small kids, usually with small kids, sometimes with teenagers, but still everybody below 18, or families where one of the partners have disabilities, and this is why they were allowed to leave country at the beginning. This is important to remember because the needs of these displaced people will be very different compared to the needs of other refugees. And we can go to the next slide. Thank you. So I just want to provide a bit of a context behind of what is happening. So there's a lot of fragmentation right now on policy level. What information is described in the media and what information is made available to public and to healthcare workers is very different from what actually happens in reality. There's a lack of centralization and systematic oversight of how things are done, how things are communicated to the community, how things are communicated to healthcare workers, because we don't really have a lot of directions around how to provide care, how to increase access to care, what kind of care is actually needed, which really results in a lot of frustration on both sides, including clinicians, because it's very difficult to navigate without much oversight. The community-based level where most care is provided at this point are community-based organizations like settlement organizations. In Toronto, one of the biggest organizations is CUS, Canadian Ukrainian Settlement Organization. They deal mostly with hands-on type of concerns, how to apply for documentation, how to find clothing, how to find housing, like very tangible type of help, which is also quite difficult to navigate because it requires not only knowledge of resources, but the availability of resources, which again becomes problematic given the inconsistencies in immigrant status. A lot of displaced people have different type of status documents, even though they all come under so-called the same umbrella of emergency entry. Social media groups lately became almost like a grassroots initiatives with a lot of hands-on help, especially in Toronto. I know there are similar groups in BC, in Alberta, trying just to basically manage displaced people on their own. There's a whole Facebook group on Canadians hosting Ukrainians, and they offer housing, they offer places to stay, they also pick people up from airports, they pool money to help with tickets. Like that's probably one of the, it's actually remarkable to see the level of response and help people able to engage and offer. On a cultural level, I think it's also, well, it's important to keep in mind that Ukrainian immigration to Canada was happening in sort of like waves, and each wave goal was very different compared to what is happening right now. They've been official for, somebody say, 5 waves of immigration. They started before the first world, and then the second one, and then during the Soviet era, and more so like economic refugees after that, and people we're seeing right now. Because of what kind of population came and how established that population is at this point in Canada, there is a bit of a tension between different immigration groups, and a lot of times what we see when people come to Canada, and obviously naturally they want to connect to the community, they want to connect to Ukrainians, because a lot of times they don't speak the language, they don't know a lot. There's a lot of tension between older diaspora where people came were in like early before war, and their ancestors came before war. So that's a very different population. And people who came within the past 10 years, which mostly highly educated, several universities degrees, people who worked in Europe, people who came to Canada either for study or because they had job offers. And now the people who are coming, a lot of times not really by choice, and not because they really wanted to go, but because they had limited options and it's bombing, and that's one of the opportunities, and they choose to go because they need to help their kids, or they need to have a safe environment. So there's a very notable cultural difference between different cultural groups. And a lot of times what I see in practice when Ukrainians coming in, and the one of the goals, like you can refer them to the community organization, and you refer them to community organization, and that's just not the right fit, because if we don't know the mission and what is behind organization value-wise, sometimes the fit is very poor and it's not helpful, and people just end up falling through cracks. On individual level, for displaced people coming right now, they do have very high reliance on community, which was not the case with previous two waves, because again, people were coming sort of as to work or to study. So they did their research, their English was much better. They knew a lot of very basic information available, and they didn't need that much of a guidance. People who are coming at this point, most of them come with very limited language, with no knowledge around the culture and what is acceptable, what is not acceptable in Canada, and how just to navigate system in general on a very basic level. It is also a very high risk population, vulnerability wise, again, because we have a lot of women with kids coming, a lot of young women with young kids coming, and in a system where there's no free childcare, there's not much help otherwise unless somebody is working, and it's very problematic to find a good job if you have a 5-year-old in your house and you have nobody to sit with your 5-year-old, and then you have no language, so you cannot find a good job. So there's a lot of complexity behind, and I know at this point there've been several very unsettling cases when women were basically taken advantage of, and they were told very bluntly that you're supposed to cook and you're supposed to clean and you're supposed to provide other advances for basically free shelter. So the Facebook group, which is hosting Canadians for Ukrainians, they try to do some vetting and some sort of screening, but this is very problematic and difficult to do, especially because a lot of people still may not have full access to information. They also may not know that they actually can ask for help, and like we can call police, and it's fairly normal. So there's a lot of concern from clinicians and from community service workers about the risk and vulnerability of this population. And unfortunately, at this point, we really don't know how to address that. So that's probably something we will figure out down the road. And we can go to the next one. So why am I presenting about Ukrainian crisis for healthcare workers? Again, as we discussed before, the amount of people coming, the large amount of people coming who are extremely traumatized, who are completely unprepared for settlement, and they are coming into spaces where spaces are not really prepared for them. As healthcare workers, where they're going to go? The first thing they're going to go, they will go to settlement organization, they will go to community clinics, and they will go to the hospitals. And we need to keep in mind that as healthcare professionals, we have been already through over 3 years of horrible pandemic, a lot of pain, a lot of losses, a lot of burned out in general. So there is this pandemic context which resulted in mental filtering in general on population level, where people more so tend to catastrophize and be more negative. And it's very easy to discount positive, because it's not like we see a lot of positive in the media. Just the other week, they've been shooting in the US. So there's a lot of cognitive distortions right now coming through media and on a daily level, which really supports this black and white type of thinking, and really unfortunately reinforces this negative thinking down the road. Also, in general, regardless if somebody has or do not have any ties to Ukraine or any interest in Ukraine, because of geopolitical location of this country, it does have very clear impact on global level. I mean, economical. There is a change in food security chain. There's a change in access to fuel and gas prices, as we can see, coming up. There's also an overall sense of lack of security, because there've been a lot of wars. They probably will continue being a lot of wars. The positioning of Ukraine, because it's sort of on the border between Russia and Europe, brought realization that war can get very close to European countries. And given that we haven't been, most of countries have been living quite secure lives, that this is a big mental change. This is a big psychological shift in how people perceive what is safe, what is not safe, and how in general they locate themselves in an environment and can consider that this is a safe environment. So all of that results in so-called web of distortions, when we tend to see events through very black, sort of like grayish type of lenses. And can go to the next one. We're basically in sort of bottleneck right now. We have pandemic mode, and it's been going on for 3 years, and it will take some time to get over, if we're going to get over it at some point. Then we already had a lot of challenges with the access to resources and access to care, not only provincial level, like Ontario, unfortunately, quite challenging with care and fractured resources, but nationwide, we know that there is a lack of access to family physician. We know that there's lack of access to care in remote areas. Plus, now we have displaced, large population of displaced people coming in addition to all of this. And unfortunately, it develops this bottleneck for healthcare workers, which obviously can result in a lot of burnout. And next, please. I'm talking a lot. As you probably know, the signs of burnout can be different. They're physical, behavioral, and emotional. On a physical level, people may start to experience more headaches and body pains and stomach problems and weakness and fatigue, worsening in chronic conditions. There's a lot of behavioral changes, especially related to sleep and disordered eating. There are a lot of emotional reactions. You know, I hear a lot, I cannot concentrate. It's very difficult for me to be patient. I love my job, I love my patients, but I cannot just handle it because I'm so irritable. There's a lot of shame and guilt associated with the events as well. And it's mostly coming from people feeling like, oh, I should be doing so much more, or feeling that we're so good, like we have it so great here and it's so safe and we have everything and people have nothing. So that also contributes to feeling sad and feeling very hopeless. And I think hopelessness, probably most prominent emotion I see right now in healthcare workers who are coming to get help, that it is very difficult to see anything positive, or to accept that something good actually can happen in the future. And we can go next. So and we see that we can do that. So my question is, can we actually do that? Can we really do it? We've been hearing that for 3 years. We can do it. We're heroes. We're doing all of it. And then what I see in practice, that people crash, which is completely normal, because there's only that much one can do. There's only that long one can go just using the push. So what is resilience? Resilience is not just coping. It's not the way, okay, I will be able to do it. I'm gonna push it through and I'm gonna be okay. Resilience is being able to handle crisis without getting overwhelmed with the crisis. It has very clear, proven, evidence-based protective effects against depression, and anxiety disorders. And resilience traits are basically what helps to strengthen the basically mental capacity. Strong relationships are very important. They don't need to be romantic or family ties. A lot of times it's about good teams or amazing friendships. Self-motivation, things I want to do for myself, positive view of ourselves and our confidence in our abilities, which is very problematic in healthcare workers, because a lot of us are A type of personalities. We tend to be very perfectionistic, and it's very difficult to be confident in our strengths and abilities. And unfortunately, media and not necessarily support that. And there's a lot of rage and bashing of healthcare workers, especially over the past like 6 months, that they're not doing enough. It's never enough. Whatever we do, how we do that, somehow it's still never enough. So that's really difficult, especially during the pandemic. Skills in communication, how to verbalize your distress, how to express your emotions and what to do with them is very important, which also is tied to self-awareness and emotional control, and demonstrate good resilience trait. And we can go to the next one. So what do we need to do? How to boost, what kind of mental exercise we need to perform to do better? Self-care is a foundation, and I've been giving several talks about the impact of war in general on mental well-being, and I cannot stress enough that self-care is a foundation. It's this one of the cases where you put your mask first, for sure. It's not selfish. It's not. This is basically one premise of how you can work, because if somebody is breaking down and you're going to break down, there's no way you will be able to help. You need to maintain your own stamina and mental health in order to continue to help. We have a psychological syncosis when we start feeling guilty that I could have been doing so much more. Oh, I still can help this person, or I need to take care of this person. And we do that because this is a part of our profession. The altruism is a premise of healthcare in general. What is important to remember is that is not supposed to be at the expense of self-care. How we can maintain self-care is to focus on things we actually have control over. War, we may have control, we may not. We can change our environment, we can change our workplace, we can work on strengths, our relationships, and think about, people are different, but do I need to get a new person? Do I need to establish new relationships, or am I better off with very well, solid, established network? Everybody is different. You choose what works for you. Relatives and family members can be either great source of joy, or it can be quite challenging, especially during the times like pandemic, when people have very different opinions, and also about war, and where people also have very polarized opinions on how it's supposed to work and what's supposed to be done. And next, please. So what to do exactly? Well-being. Accept that this is what it is. That's probably the biggest one and the most difficult one, the simplest one. We need to accept that this is the reality of where we are. We are all burned out. We have very limited number of resources right now, and we need to hoard those mental resources: physical exercise, emotional well-being, spiritual, reinstate control, choose what you can and cannot do, outsource everything you can. A lot of times I hear, especially around female healthcare workers, childcare obligation, family obligation, marital obligations, work obligations, and it piles up. And it's very difficult to outsource and let go, because it feels like you always need to be in control and you always need to manage it. Well, that we're going back to basics, to the self-care. If that's something which will serve the purpose of self-care, If yes, great, but if not, maybe you need to reconsider. Aware of risk patterns, sleep, alcohol, engaging in unhealthy behaviors. And if you feel that you've done it all and you're still not doing well, then you probably need to ask for more so for professional help. Next one. Focus on things you can change. And usually it's environment. It's personal space or it's a workplace. Personal space, which is safe, comfortable, and easy to access, can have very therapeutic impact on mental well-being. It does not need to be a renovation and the whole house to myself. It can be a space in your house or space in your garden, somewhere where you can stay on your own and just process your emotions and reflect on your emotions. The workplace around schedules and shifts and hours of work and team environment is being shown that strong teams have very positive impact on mental health. They increase cohesiveness, they increase the sense of belonging, and they're actually very protective against depression. Of course, organizational support, that varies from organization to organization. What's been demonstrated in the literature that peer-to-peer support can be as beneficial as familiar or romantic relationships. And again, reach out for professional help if you feel that things are escalating and they're not really moving in the right direction. And next one. This is a very busy slide. So this is more so what to do for yourself if you're somebody who has connections to Ukrainians and you talk to your family in Ukraine, or you have a patient coming and they have family and they ask you as a healthcare worker, I don't know what to do. Like, how can I manage that? Because I cry all the time. Do and don'ts, basically do's the same as we've just discussed. Don'ts, especially if it's somebody here who's talking to somebody there, try not to offer solutions. There's not much solutions to begin with. Not to advise unless there's an explicit ask. Please, can you please let me know? And just being there, being present. That's basically all most people need. Just to listen and vent. For the social health and for the social well-being, how to cope with distress when somebody is here and their family is still there, especially as we as healthcare workers, we will be getting patients who left their family in Ukraine, they're fighting in Ukraine. They will be asking you, I don't know what to do. What do you want me to do? Focus on things, on so-called positive actions, on building social health, being more open to meet new people, being less isolated, especially because it's a new country and it's a new community and it's a very different community. Trying new things, and it doesn't need to be major things, but something new and pleasurable. Gardening, walking, being in nature, talking to another person. Things which are very, very simple, but can really elicit the sense of belonging. And the next one, please. This is just a couple of slides to ensure that you do have resources if people ask you. So, and this, most of them are Ontario based, obviously. So there's a call for primary care providers who want to take Ukrainian displaced people as their patients. So that's coming from the Women's College Hospital. There's also a call from the psychology services, and they actually want to provide psychology, like psychotherapy, to people from Ukraine, and it's free for service, and they will be covered by insurance, which is amazing. There's no roster yet, but they're working on it. CAMH also developed a page of resources where you can go and you can look into how to cope with stress and also have access to all those resources. Refugee Health Line is working more so like centrally right now, collecting physicians' names from different providers and the specialists as well who want to offer services to this population. So you can basically call the line, say, okay, I have this Ukrainian person, they're looking for A, B, C, D, what can you recommend? And you will be provided with a list. And the next slide, please. This is from partially from CAMH, so self-referral for healthcare workers. You don't need to have any family physician referral. You can just click on a link, and if you are in distress, COVID-related, Ukrainian crisis-related, war-related, or you're somebody who's been through war and it's triggering, or you have not been through war, it's just very triggering given the amount of exposure in social media with very graphic images, and you feel that you may benefit from some help, click the link. You will be referred, not necessarily you will be seen by CAMH psychiatrist, you will if you want to, but we have a group of other physicians who are seeing healthcare workers across Ontario. Resilience and Hope for Ukraine is the messaging service which has been developed by Alberta Group, and you can register, and they provide it's sort of like a ECBT type of thing, and it's very helpful, especially for somebody who's just coming in, and it's an additional type of support. Mental Health Commission of Canada also developed self-care resources for people who are distressed by the conflict, and it's not only for Ukrainian, that's for everybody. And the next one, please. This is mostly about what organizations are dealing with Ukrainians, because if you need guidance, if you need settlement help, if you need any clarification, so you want to connect them, the easiest way and the fastest way is to actually connect them to the settlement organization. So in the GTA, it's a Canadian Ukrainian settlement organization. It's the biggest one. UCC, Ukrainian Canadian Congress, they work more so on policy level, and they've done amazing job in regards to this entry, express entry and OHIP coverage. Less so on hands-on type of help, but they always will be able to recommend other organizations. Same for the Canadian Ukrainian Foundation and UNA and social media groups. These are fantastic, and there are a lot of them, and they do really a lot of work on very grassroots level. And the next one, please. Okay, I'm almost done. So, and I know I talked a lot. What I wanted to ask, if anybody is feeling comfortable to share experiences, what is the impact of Ukrainian war on your coping and well-being? And you can share in the chat, or you can just talk, or whatever works, like just to reflect on what actually you as healthcare workers see in your daily life.